Okay, what I'm going to do now is I'm going to take his sexual history, and I like to do that by himself, okay? So what I'm going to have you do is wait in the waiting room, and then we'll bring you back, and we'll go through how erections work, why yours may not be working, and then what the different treatment options are. Okay? What I want to do now is just get a sexual history, get a sense as to what's been going on. So I see that you're 37.
That's right.
Okay. And how long have you been married?
A couple of years now.
Okay. And were you together before that? Or?
Oh, yeah, several years before that.
Okay. Tell me what's happening when you go to make love.
Well, I guess in the past year and a half, it's been getting a little more difficult for me anyway. I don't get as hard as I used to, and it takes longer
to get an erection.
It takes longer to get an erection.
Okay. And is it beginning progressively worse than in that year and a half? Okay.
Yes, it does.
And at this point, are you able to get a good erection?
Some of the time.
Okay.
But even when I do, it's less.
Do you have a hard time holding on to the erection?
Sometimes.
Okay.
Sometimes it doesn't really happen at all.
Okay. So sometimes you don't get the erection at all, and then sometimes you get it, but you have a hard time holding on to it.
Well, usually if I lose it, it's right. Yeah, it's right as I'm poised to.
When you're positioning for intercourse.
Right.
Okay, and that is a very frequent time. If you think about it, it makes sense because you're not getting direct stimulation, and you're also a little anxious, because that's when you really have to perform. Do you ever lose it while you're inside?
Sometimes.
Okay, okay. And during foreplay, not really?
No, mostly I'm just worried about
succeeding.
Okay.
Any problems with ejaculation, developing any early ejaculation?
Yeah, it's
a little prematurely.
A little quicker. That's been.
Okay.
That was never a problem before.
It wasn't before, so that happens since you've developed the problems with the erection. That actually happens quite frequently. In general, once we treat the erection successfully, that will go away. So we won't address that right now, but if we're treating your erection successfully and you still have the premature ejaculation, then bring it back to my attention and we'll address it kind of as a separate issue. How often are you making love at this point, would you say?
Maybe twice a week.
Now, so you're still making love twice a week?
Well, ideally it used to be like twice a week or so.
Okay, and it's kind of down now.
And it's going down a little down now because it's just anxiety ridden.
Okay. How are things between you and your wife? How is the marriage going?
Fine.
Okay.
Except for the anxiety.
So you're strong as a couple, but this is just kind of.
My wife's very supportive.
Okay, good. What I want to do is go and compare your erections that you're getting now to what they were like when you were 20. Okay. So if when you were 20, you were 100% rigid. Okay. Yes. How rigid are you getting now?
I guess right now it might be 80 or 85%.
Okay. And what about when you masturbate? What kind of erections are you getting there?
It's a little better.
A little bit better. Okay. That's actually pretty typical because obviously there's no stress on you when you're masturbating. You're not really trying to please anyone else but yourself. And so we find that people's masturbatory erections are sometimes better than their erections when they go to make love. And what about the nighttime erections? How are those?
They're better too.
They are better. Okay.
They're the same as they always have been.
Really? Oh, well, that's actually a very good prognostic sign. Okay. Did you ever injure your penis that you can think of?
Not that I remember.
Any pain with your erections or with intercourse?
No.
Okay. And did you ever injure the area between your testis and your anus? That's called the perineum.
No.
Nothing. Okay. Did you have any previous evaluation, or have you seen anyone?
No, this is the first time I've ever.
Okay. Good. So what I'm going to do now is I'm going to bring your wife back in, and then we're going to go through how erections work, why yours may not be working, and then what the different treatment options are.